Hello, everyone, and welcome to the Healthcare Industry Podcast by Camomile Healthcare. Yeah, hi, everyone. I'm Raghav. I'm the CEO of Camomile Healthcare. Now, welcome to this podcast on Indian Healthcare Leadership Series. We're going to touch upon a lot of topics on what it requires to build a successful healthcare and hospital brand. Today we have an highly renowned and one of the leading healthcare leaders, Dr. Harish Pillai. Harish actually requires no introduction. He's been with some of the leading healthcare institutions in the developing world. He's an acknowledged leader in India, Egypt, and now he's in the Philippines, and he's also been in the Middle East in Dubai. So we are going to really, have a chat with him and understand from his perspective on what it takes to build a successful hospital brand, what it takes to build a successful hospital operations. We'll cover topics from project implementation and hospital execution excellence to managing doctors. I think looking forward to this conversation. Welcome, Dr. Harish. Hi, everyone. I think welcome, Dr. Harish. Pleasure to have you out here. Just to set the context, I think we are hosting Dr. Harish Pillai, a senior healthcare professional. Harish has worked in Egypt. He's now as we talk, I think he's in the Philippines, and he's also been in the Middle East in Dubai and others. So he brings extensive experience of managing large hospitals and complex healthcare systems. Harish has been with companies like Aster, where he led the Aster Group of the Indian operations of Aster Group, into a large network of facilities in India. And prior to that, he was in Egypt, and now he's in Philippines, managing much larger responsibility of the Metro Hospitals Group, which span over 3,500 beds. Thank you and welcome to the podcast, Dr. Harish.
Thank you, Raghav.
So the structure of the podcast, to just set things clear, is going to be, we're going to touch upon a few topics and pick on your experience to understand what's in store for healthcare in general, and certain key areas that healthcare is actually looking forward to addressing. So we'll go ahead. I think the first one, I think, is what comes to my mind when I speak to Dr. Harish is he brings a very unique a mix of experience of having worked across three geographies, while all of them three key geographies. I think he's worked on more than three geographies, but I would probably restrict to three geographies in this discussion. He's worked in Egypt, he's currently working in Philippines, and he's worked for a long time in India. While all of them are developing economies, but they do differ in terms of the level of sophistication that the country has in terms of healthcare and in terms of their GDP. So it will be good to hear from you, Dr. Harish, on how these markets differ. Are they largely similar? If they're different, how different are they, and what aspects are they different?
Thank you, Raghav, for hosting me. So it's a pretty interesting question to set off our conversation for today. So let me just address what you wanted to check was in terms of commonalities and differences between these three interesting markets. So before I address that, I also want to tell you that to be good in healthcare, especially in healthcare management, you need to be a student of history and culture. Because many people make the mistake of thinking that, so what's the big deal? So you have doctors and nurses and hospitals around the world. But I suppose, the management mantra is all the same, but it's really not. People are as diverse as they can be. And one advantage of coming from an Indian background is, I always refer to India as the United States of India. It's like a large basket of multiple civilization, and it's almost like a mini world, and it prepares an Indian administrator to really make his or her mark in different markets. and different societies. Egypt was quite fascinating because it's as old as time itself. It's as old as India. And so from that perspective, the Egyptian healthcare system was quite interesting. I will refer to the management aspects a bit later. You are right in terms of the demographic slice in all these three countries. So relatively, when we look at age, the age bracket of the population, they all the three of them are relatively young, and they are growing rapidly in terms of economic development. The contribution of services sector in the Egyptian economy is quite high. Before the pandemic, tourism was a big revenue earner for Egypt. And from the Pan-Arabian and North Africa setup, the contribution of IT services and BPO for the Egyptian economy was also quite significant. So services are quite important for that, and that actually leads up to growing affluence in the Egyptian population, especially the middle class segment. You also have a large percentage of out-of-pocket expenditure, which is a bit similar, almost like the Indian scenario. One, when you look at these three markets, another interesting aspect is that when you look at actual cost of care, from an input cost point of view, of course, India has a lot of structural advantages. One is to do with the rich human resources pool, which in fact the three markets, all of them have. Egypt has got a rich base of clinical faculty because of their university systems, and in fact, Egyptian workforce. Egypt was a net exporter of healthcare manpower for the rest of the Middle East and GCC countries for a long period of time. So that advantage Egypt has. Now, when it comes to Philippines, as you would have already known that Philippines is one of the world's largest exporters of nurses to countries as diverse as United States or Europe or to Southeast Asia. It's similar to India from that point. So quality of human resources in healthcare workers in Philippines is also quite good. But among the three markets, India's distinct advantages, India is the pharmacy of the world. So from the key material input for the healthcare segment, the fact that you have such large biotechnology sectors, R&D facilities, and you're able to produce generic drugs. And also when we look at modern trends for medical value travel, like to give you an example of that, you would be surprised to know that as early as the peace treaty between Egypt and Israel, based on the Camp David agreement, the agreement signed by President Anwar Sadat and Prime Minister Menachem Begin, one of the first investments in the private sector was actually to take care of medical value travel or medical tourism to Cairo from the rest of the Middle East. And that was an asset in which I was later, after many years in 2006, when I went to Egypt, I was actually associated with that hospital, As-Salam International Hospital. So the name As-Salam in Arabic means for peace. And this is actually related to the political history of that country. So it's quite interesting how healthcare is. And just to give you an insight that when this hospital this is an American designed hospital, 350 beds located on the banks of the River Nile, you had almost 70 nurses. The CEO at that point of time, when it was commissioned in 1984, the CEO, chief operating officer were all Americans. The nursing workforce were predominantly brought from England and Wales. So that's the kind of the work structure what this hospital had. So that was kind of a powerful vision to bring in high value medical tourists who are able to spend that kind of money for the Egyptian economy. So this is just an example which I'm telling you. Of course, India clearly has a pole position today in the world of medical value travel. In the Philippines, I think the prospects are quite good. Not now, maybe in another 3-4 years' time. The advantage for Philippines is it's a hotspot for tourism anyway. It's a beautiful country, well known for its islands, and the medical expertise is quite good. So I hope that there will be a spin-off like what we have seen in the Indian market, also to have inbound traffic from the neighboring region. Currently, it's outbound. There is traffic flowing from the Philippines to countries such as Singapore or even to India for complex medical procedures. So that gives you a context of where we are in now.
Excellent, Dr. Harish. I think very well put and gives a perspective of the key differences between all these three markets, while all of them fall under developing market ambit. But I think it looks like there are quite a few changes, differences. One thing I want to probably ask is, how intense is the consumerism in healthcare in these markets? See, in India, I think we're seeing a lot of consumerism. I think 10 years ago, I think it was only the doctor that that patients wanted to see, and they were happy if they met the doctor. But today, I think they're looking at much more than the doctor, right? I think they're looking at, are you enabling digital appointments? How clean is the hospital? Are you using Italian marble? How big are the rooms? What facilities do the rooms have? And they're all becoming important influencers in choosing a hospital. So how does that compare with, say, Egypt or Philippines?
So these models, like you said, from 70s to 80s to 90s and 2000, there has been a clear shift in consumer behavior. In the earlier paradigm, the doctor clearly was ruling the roost, because the patients usually went based on the reputation of the doctor and usually go to his private chamber or his private clinic, and the doctor decides which hospital the patient needs to go to. That was earlier the paradigm. Now, we are increasingly looking at hospitals where you have on-staff model, or at least an arrangement where the doctors prefer to spend a large amount of their time in an individual hospital, or at least one dedicated network, which includes their own primary care centers. Yes, there is a big shift in all these. I wouldn't say that they really look at the materials used for construction, but yes, they would definitely look at, if you're an insured patient, most insurance companies now, based on your premiums paid by your employer, would prefer to have at least a single room as an inpatient if you're going to. So in that case, I think from a consumer driven choice, branding and reputation of the hospital definitely plays a key role. And branding in hospital communication is a pretty complex phenomena, where you have elements of your infrastructure, your location, your pricing strategy, your case mix, in terms of whether you're a single specialty, multi-specialty hospital, your clinical outcomes and your reputation, testimonials of patient, and of course the consultant profile.
Wonderful. That's, I think, amazing experience of handling different geographies and the complexities of the medical faculty. Yeah, I think moving on to the last leg of this podcast, I think I would like to really understand, what does your typical day look like as the CEO of some of the most prestigious hospital groups in the developing markets? What does your typical day look like? And what pointers would you want to give to budding managers who aspire to become CEOs 5 to 7 years down the line? What skill sets should they probably build on, and which would probably be very important for their growth in the hospital, and how can they build it? How can they build also, I think is an extremely important point, because it's not easy to acquire some of the skills. So I'm sure you probably tracked it in terms of what skills are really important and how to acquire them. It would be great to hear about that.
It's very important for budding hospital, especially the youngsters listening to this podcast, that you need to be a well-rounded personality, in the sense that you should not be unidimensional. If you look at my own experience in working in different states in India, in different countries, I always told that in public forums, that I'm very passionate about culture and history of people. So in India, for example, in the case of Aster was having locations, let's say, in Kerala, but many people think that Kerala is one monolithic state where all the Malayalis live in Kerala and that's it. But it's not true. If you go and try to do what you did in Cochin, Cochin is so different from Kozhikode. Kozhikode itself is very different from Kannur. And Kannur is completely different from Trivandrum. So every 14 districts of Kerala have got 14 different cultural facets. So if you're ignorant of people behavior, example of what I meant, I landed in Cochin in the construction site. I joined Aster in May 2013. But in March, I flew down from Cairo to Kochi on the construction site, and it's in front of the river Periyar. Right. So I met the engineering team, the construction. So one of my first questions to the project team was that, could you please give me the 100-year flood data of the river Periyar? I asked them this question. Wonderful. So they all were laughing at me. They said, "What you're asking?" And they said, "We have done all those things, and there will be no floods, and the hospital design is perfectly well." But I used to constantly ask these questions. In fact, I have recorded it's all in writing, because I have the habit of writing emails and putting it on record. 2018, the floods happened. There was this aggravated weather phenomena, cloudburst. The Periyar actually flooded, and the hospital got impacted. So that's what I'm trying to say. You need to really understand what's happening in terms of the climate change impact on hospitals. So very important to be multidimensional for young hospital administrators to be really successful in that. That's the first lesson. You've been there. So what I'm trying to tell youngsters is that, yes, it's good to have dreams and aspirations, but fold up your sleeves and get your hands dirty. You have to go to the trenches and go to the front lines and learn the hard way, the nut and bolts of hospitals. So this is my second message for youngsters. Third message is, it's always very important to have empathetic leadership, because hospitals are a very stressful environment. You need to ask yourself 100 times, why the hell are you working in a hospital? Like for me, it is easy. I'm a doctor. So it's a natural ecosystem, which if not this, what will I do? So that is my question. But others who do not have a healthcare background, you should seriously ask this. Do you have the stomach for, I'm a crazy guy. I'm not a role model for anyone. I'm a workaholic, absolute workaholic. I breathe, eat, and drink healthcare. So that's the kind of a person I am.
Sounds very familiar. Sounds very familiar, I said.
Yeah, so I'm a workaholic, but I'm an early riser. I have a certain set routine in terms of discipline. I usually wake up at 4:30, 5 a.m. in the morning. I have a certain fitness regime which I follow through, because stress is a fact of life. Then how do you beat stress? So aspects like pranayama, a bit of yoga, a bit of aerobic exercise or weight training, whatever suits anyone, I think that works out well. I actually divide my time in such a manner that time management is essential. That it's very important for a successful leader not to get burned out and use execution mode. So usually that's, but of course the pandemic has been a big challenge. Usually I'm a people person. I love to engage with my staff members. I love to dance, by the way, Raghav, and I use dance. And when I started my hospital in Kochi, I guess there's also a cultural paradigm you need to break. So I use large group dances in a big way to get the team together. I love music and dance. So when we first got a Joint Commission accreditation in 2015, I threw a party for my entire team, which includes the housekeeper to the consultant. And it was like a big bash for everyone. And of course, I was clearly up there on the stage to dance with my team members. So I think it's a great, music and dance is a powerful element to get the teams together. So here, the provided,
I think this will be a phenomenal podcast.
Thank you so much. Enjoyed our conversations, and good evening to all of you. Thank you.
Thank you.